and welcome back to Aging Well, monthly production of Somerville-Cambridge Elder Services. I'm your host, Nathan Lamb. With me in the studio today is Annie Keefe. Anne, great to have you here.
Great to be back.
Oh, excellent. So we were talking a little bit about dementia and Alzheimer's and other memory disorders. And in the first segment, we talked a bit on diagnosing them and recognizing the symptoms. In this segment, I was hoping we could talk a little bit about how our agency is able to provide some help for families and caregivers who are facing challenges because of Alzheimer's and dementia. So I guess, can you tell me a little bit about some of the supports that our agency offers?
Absolutely. So we have a Family Caregiver Support program that offers individual and family consultations, either in the office, in their home, or extended conversations over the phone if it's difficult for caregivers who are working. We have educational materials. We have dementia coaching sessions. We, in some situations, we can do conduct family meetings for family members. We also, can refer out to caregiver support groups in the area. We have a wonderful guide for caregivers that's put out by the National Institute on Aging and the Alzheimer's Association that provides really, a very simple guide on any number of topics that are related to areas of where you might be having some difficulty, like, how do I discuss communication with my loved one, with my family member, or how do I, if we're going out to a restaurant, what do I need to be thinking about to make that person comfortable? We also have within the agency a music and memory program, which is really wonderful. And that is a program, we know that music is, very strongly connected to memories, and that music can elicit these memories. So we can find out what music is meaningful to that person, and we can put a playlist on, like these iPods, and can provide them for that family member. And it's amazing to just see that person come to life when they hear music that they really can relate to. And sometimes you notice even that someone who, is kind of nonverbal all of a sudden becomes pretty, talkative and can talk about, that experience, that time in the past. There are memory cafes locally in the area that we can tell people about.
It's interesting. We had a conference on dementia a few months back, and I remember there was a segment on memory cafes, which was very eye-opening for me. And around the same time, we did launch the music and memory program, and there was a couple things I liked about our music and memory program. One of them was, I think there's a lot of adult daycare providers who offer it, but to our knowledge, there weren't really any other providers who would bring it into people's homes the way that we did. And it's kind of cool that fits with how our agency is all about helping people do things in home. And we sort of brought that in home for people. But we did actually put a feature on that in our most recent issue of The Advocate. So definitely at the end of the show, I'll give people a little more information on. There's also a video that Music and Memory put out about their program that really explains it better than we can. We can sort of explain it. Somebody explained it to me, and I had one reaction. And when you watch the video and see the video that they did presenting how the program works, it was really kind of amazing to see how well it worked, that it really did help this person reconnect with these memories. in a way that I didn't entirely think was possible until I saw it. So
Right.
it's an interesting program, and I think we had a fair number of people who signed up for that right out the gate who were interested. I don't remember the exact number, but I think it was a few dozen people who were involved with our adult family care program that were curious about that.
Right.
So.
The other thing I wanted to mention, Nathan, is that our aging information staff is teamed with professionals who have very good knowledge of dementia and assessing, and so we can help that person navigate the array of resources out there, because it can be very confusing and can sort of point the person, the family member, in the right direction and help them come up with a plan of care. So, and we can follow that person, follow that caregiver, and be there as a coach for them when they, when questions come up. So it's a very sort of specialized service that we can provide.
It's probably that guidance is really important when you're kind of having to learn on the job. I became a parent a couple years ago, and I learned quite a bit on the job very quickly, and I suppose probably being a caregiver, kind of the same thing at times.
It sure is.
But, and one other thing before we go to break that I just learned about, we do not have a memory cafe, but we had a speaker that was involved with memory cafes across the area. Really kind of an amazing program for people if they're not familiar with it. Are you familiar with the whole memory cafe model?
I am, yes. And in fact, there are a couple of memory cafes in our area. One that is just started up through the Somerville Council on Aging. And there's another one on Gore Street, right down the street from our agency. I have those memory cafes where people who have the memory loss and their care partners can come and be in a very laid-back, dementia-friendly space with music and art, doing art, just talking socially with other people who are going through who have the same experience.
I think two things that really struck me about it when we saw the speaker was I think the two things was, one, when you go in, it's not like they're going to ask you about your diagnosis or anything.
Right. You
kind of just come in and do your thing.
Exactly.
And the other one was that to reconnect socially, that it's very difficult when you're sort of going into the caregiving thing. Your life changes, and you're sort of finding new things to do together. And I did hear some anecdotal accounts about how it was important for people who were going to the cafes because it was an outing they could do, it was enjoyable. It kind of replaced things that maybe they couldn't do anymore. So it was very eye-opening to me to learn about it. I didn't really know what it was all about, but it sounded really promising in terms of ways that we can support people in the community who are facing these challenges.
Right.
So that's all for this segment. We'll be back with one more quick segment of Aging Well. Thanks again.